Good morning, Cal Health Agent clients. I am recording this video in Tuscany, Italy. I'm actually flying home today, but I wanted to make sure that I got this Medicare, how to use medicare.gov to optimize your drug plan video out to you ASAP. So you can jump on it, take a look at the plans that are available in your market, and make the right choice. So I'm going to show you exactly how to do it. This video is going out to 826 people. So it's going to be real tough for me to do one-on-one meetings with you all about this. So this tool is a good tool. And let me show you what I mean. I'm going to share my screen. I have navigated to medicare.gov. You can see right here. So come to medicare.gov, log in. I'm going to log in as my husband because I am going on Medicare next year. Can't wait. So I'm logged in as Greg. And the first thing you'll see is that medicare.gov is now kind of open for business. This is the annual enrollment period user interface for medicare.gov. So the first thing that you want to do is click on Find Health and Drug Plans. I mean, you can take a look, you can see what they have. You can see that he has the current Cigna Assurance. That's the plan that's changing to Health Spring. They're just changing their name, but otherwise the plan is going to stay very similar. And he has United Healthcare as his supplement. But I'm going to click on Find Health and Drug Plans. It's telling me that what his 2025 plan is. So that's always the first thing you'll see. And that was that $1.80 plan many of you are also on. And then we're going to look and see what else Medicare.gov has in file for him. So it has the Cigna plan, that drug plan, and it has his United supplement and the date that it started. It has any info about getting financial help for Medicare. He happens to not qualify for extra help, so you can see that there, both for 25 and 26. Other help, he doesn't qualify for any of that, so I'm going to skip through that. And then I added a couple of pharmacies. This is where you can come and edit your pharmacies. So we happen to use Safeway in Walnut Creek, or he uses mail order. And sometimes mail order can really save you money. In order to use a mail order pharmacy, and every drug plan has one, your doctor just needs to prescribe directly to the plan using your ID card. So here's his saved pharmacies. I'm going to remove ScriptWorks. We don't really use it. And I'm going to say, I could say add another pharmacy, put my location, find pharmacies in 94596. Mail order's already checked. I'll put Ridgecrest in, sure. And then continue to plans. So I finished with my saved pharmacies. I say, okay. Now we're going to look at his medications. There's the pharmacies again, his drug list. So this is the most important thing. Medicare.gov makes a drug list for you based on the drugs that you fill when you're on Medicare. It doesn't work when you're on a Medicare Advantage plan, but when you're on Medicare, original Medicare with a supplement and a drug plan, then you'll see the drugs that you've filled. So we could say edit my drug list. They have add recently filled drugs, add another drug. So I'll say, he's on losartan potassium, add drug. It's going to ask me what size. I'm going to say he's on a 25 milligram. He's taking one a day. That's 30 per month. Maybe he'll take, that's usually what you do with blood pressure medication. So add to my drug list. And then I can just say remove drug. And there it is. So work on your drug list. For clients that are looking at this, that have a very long drug list, I probably sent you a copy of your drug list just to make it easier for you because I'm using a very similar database, same data. Okay, and I'm done adding drugs. And The next thing to do as we continue scrolling down, there's our pharmacy and the work that we did there, our drug list, the work that we did there, and then it says ready to shop for plans. Yes, we're ready. So I'm going to say find plans now for 2026, continue, and I'm going to choose drug plan. Find plans. The beauty of me making this video for you is you can stop it at any point and go back and, rewind and pause and do this side by side as you're doing your own analysis. So that Cigna plan is now called HealthSpring. So it shows you, by the way, this list is sorting by lowest cost of drug plus premium. Leave it on that. That is the most important way to sort. And the number that we really care about is both the premium and what you pay at the drug counter. So if he did nothing, his next plan is this plan, because this is just being renewed into the same Cigna plan that many of you are also on. And notice, for the first time since I've been doing this work, since 2013, there is no premium on this plan. So I assume many of you are going to end up on this plan. And then the next one down is WellCare Value Script, and it's sorting on this number. Notice this mail order number is quite a bit lower. So I'm going to get him to start, to stop using Safeway and to start using mail order next year, and save a little over $200. So you'll see for the WellCare Value Script might be the first one in the list, or the WellCare Classic. It would be a new enrollment for him if he went into a different plan. And you just click on enroll and step through it. It's going to know almost everything about you other than your phone number. So for this one, that he's going to end up taking this one because it's the lowest cost, right here, it's sorting. So it's showing us the lowest cost. And also it's just easy to stay in the same plan if it works. Here's the plan details. It's going to show an overview of the premium, the deductible. That's a standard deductible. His drugs are very inexpensive, so it doesn't matter. So here we have Ridgecrest is out of network, so we're definitely not going to fill there. But it was good to find out. And you can see, CVS is in network, Walgreens, Safeway, but mail order really beats everybody. $79.20 for the year out of pocket. And I don't know how much, you really want to get into the all the details that are available here, but you can see a month by month spend. Because it's mail order, it's only showing every 3 months. If he went to Safeway, he'd spend $45 the first month, and then 12, 13, about 13, then 45 again. And this is just the pattern he would be in, and there's no premium. So you can open up different pharmacies. There's a lot of detail here, but I wanted to get you this video quickly before I'm going to be on a plane all day today, and I'm honestly not sure I'm going to, look as bright and sparkly when I get back home, and I'm kind of jet lagged. So I really wanted to get this to you and get it up on YouTube. So thanks for listening. Good luck. Take your time. It should take all of 10 minutes tops. I don't even know that I've been talking for 10 minutes. I love you all. I'm so delighted that you're my clients. We are entering annual enrollment, the busy season of the year, and I just finished up a yoga retreat, so I'm all ready to work hard. Thanks so much. Bye.